Hi there. The skill that we're going to do now is that of a secondary medication. Common secondary medications are usually a lot of antibiotics. So we're just going to say that this little bag here is that of Ancef. So we've gotten it out of the Pyxis, we've gone to our chart, we've checked the 5 rights, or the 6 rights I should say, make sure we got the doctor pat, drug route, patient amount and time, and then the correct documentation when we do it. So always remember to do that with any type of medication that you have. So I've got the right stuff. Again, make sure that there's no floaties in there, that it's not wet, there's no dripping, it's good to go, and it looks nice and crystal clear. The type of tubing that you need now is a secondary set. And you can always tell a secondary set because it's got a little hanger in there. Now, we're going to be putting it on a pump, so you technically don't need that hanger. When you need that hanger is if you're doing it with gravity. And then with gravity, you want to make sure that your primary bag is lower than your secondary. So that's what it's in there for. So, but we're doing it with the pump, so we don't need it. Again, you just look on the perforation, tear here to open, opens up nice and easy. Got my gloves on, and just like with the gravity, the first thing you want to do is clamp this, because if you don't clamp it, remember, push it all the way down, then when you spike your bag, all the fluid will start coming and you're going to get air. So, got my bag, and like you know, I like to do it going down, but if you want to hang it up there and go up to spike it, it's fine. Ooh. Got it. And I got this straight down. Just enough so I get past that. All right. Got it here. Now, my line A, or my primary line, is going. So, first thing I want to tell you is that there's 2 different ways you can prime this tubing here. The easiest way is to do it just like we've been doing with the other one. So I'll show you that, but I'll show you the other way too. So I'm going to get that drip chamber half full. Then with the clamp here, open it up slow, because you don't want to, this is medication, so you do not want to waste any. So you can just open it up until it comes, and there it comes, until it gets to the end, and then clamp it. All right. Now, the next thing I need to do is attach it. So, on the cassette here, there's a little clave, we call it. This one's clear, sometimes they're blue. You need to scrub that clave for 15 seconds. So you got that. And then I'm gonna take, I've got it clamped, so make sure, take the cover off. And then you lure lock it on, push down and turn it. Now, the next thing you have to remember to do is to unclamp it, because if you don't, this will start beeping. And what it'll say when it beeps, it'll say that you've got a proximal occlusion. So then you, or sometimes it says you have a distal occlusion. So if it beeped and it said proximal occlusion, it's up here, it's by the machine, it's more proximal. If it does say distal occlusion, then it's more down here where the occlusion would be. So just unclamp it and it's ready to go. Now, this is going to be line B. So I stop my machine because I need to set for line B. Now, this is the other way you could prime the tubing. When you stop, then right here it says back prime. Back prime means it's going to suck it from here and prime this tubing with it. So you just would push and hold it. And you would just hold it until it primed the entire tubing. But we've already primed it. So I just wanted you to show an alternative way of doing it. So this is going to be line B, and I've already done my math before I got in here, and we're going to say that our antibiotic here of Ancef is going to go at 150 milliliters per hour. So we've got line B. The first thing that pops up, it says mode. The mode, there's 2 different modes you can pick from, and you as the nurse has to decide which is most applicable for your patient. It comes up as a default as piggyback. What piggyback means is that your primary bag is going to stop and just your antibiotic will go in. And when your antibiotic is done, your primary line will take over. That's one way. The other way, if you decided to change it, would be concurrent. Concurrent means they'll both be going. So if you chose concurrent, I'll just stick with concurrent so you can see what it looks like. Next, you just go push the down button and it goes to rate, 150. Volume to be infused. Now this is where you have to think. On our primary bag, we did not want it to go dry because we wanted to go ahead and put another bag up when it's done because it's a continuous. When this antibiotic is done, it's not continuous. When it's done, it's done. You want to give the entire medication. So this is a 50 ml bag. So for a medication, I'm going to put my volume to be infused as 50 mils. Okay, and then I can push start twice. Because now you see both of them blinking green. That means they're going concurrent. If it was just piggyback mode, just the one would be blinking. So I'm making sure everything is good. I'm checking my site to make sure there is no complications, infiltration, pain, swelling, anything of the sort. Make sure the patient's okay with it. I've got it going. Both of them are going, blinking, and there's no beeping. So we're having success. So that is how you would hang a secondary medication through a pump.